Good morning, welcome back to BT. Well, the Ebola outbreak in West Africa had a devastating impact worldwide. More than 19,000 people contracted the disease and thousands died. It was a story that had an incredible impact on the healthcare everywhere, including our province.
Right now, we're taking a look back at the health headlines of 2014, starting with influenza, which has hundreds of people heading to emergency rooms for treatment.
This year, we're just embarking on what appears to be a pretty busy influenza season, and so oftentimes, annually, we know that flu causes a lot of illness in the community and can cause some severe illness, and it seems to be doing that as we speak. Enterovirus, again, is another family of viruses, and the D68 part just means that it's a specific strain of enterovirus. The 68 type is a strain that we haven't seen a lot of, but enterovirus is related to the polio types of viruses, so in some respects that's why it causes some angst and some nervousness and some concern, because it can cause polio type symptoms. I think the bottom line for the enterovirus story is that we always see new viruses. Some viruses look a little bit different from how they have in the past. Sometimes they just come back, viruses can cause some severe symptoms in people. One of the messages that we always want people to keep in mind is that as much as you can sort of maintain your health for all the ways that you can do that by eating well, getting lots of rest, but also looking after underlying medical conditions like your asthma and making sure that that's treated properly. Syphilis is something that we've been seeing across North America coming back to a certain extent. One of the concerns around that is that there's some suggestion maybe that people are not taking some of the precautions, in particular using condoms, that prevent sexually transmitted infections like syphilis. People heard the stories about the NHL players with mumps. That hasn't percolated into the rest of the community. I don't know if any of the Jets were affected, but in Manitoba we've really had no cases of mumps. But again, I think that we also in the not too long ago had some measles cases going on both in Manitoba and other places, and we've seen both mumps and measles outbreaks happening in other parts of the world, Canada, in Europe. And again, it's a reminder that the importance of vaccination. That's really what prevents propagated outbreaks from happening in the community. So as much as there have been some cases, again, the vaccines are very effective. The Ebola story is a giant one, and it's certainly been something that we've spent most of this past year doing a lot of work around preparing. Fortunately, it hasn't affected Canada really at all. We've had no cases in Canada. It's affected us in terms of doing a lot of work, and it has affected, as you said, we've had a number of people, healthcare workers, doing fantastic work, going over to West Africa and helping them deal with what's been really a horrific outbreak. It certainly can be a significant disease. Fortunately, as we're getting more experience with the disease, we're finding that if we get treatment early and we have effective treatment early, a lot of people can recover. Certainly a good percentage of people who get Ebola do die from it, but we can provide effective treatments. So there's all kinds of lessons that have come out from this, and but we're going to have to continue to be vigilant around it, and also we're going to have to continue to make sure that we can, as much as possible, support the work that's going on in West Africa, because as we've heard and we've talked about some of these other conditions, there's no borders for infectious diseases, and so we need to work as a global community to make sure that we're doing everything we can to support all the countries around the world and prevent outbreaks like this from happening.